Hey everybody, this is Rob Smith at The Body Project with my favorite staff member of all, well, sorry Mary, Mary's running the camera so I better say one of my favorites. Anyway, so Julie's going to help out today as I go through why so many people today experience low back problems. I'm going to talk a little bit about digestion, scars, and then also one of the things we see a lot here at The Body Project is so many women with urinary incontinence or some level of incontinence. So first thing I'm going to have Julie talk about is, so Julie was experiencing a little pain, whereabouts?
Low back pain, right, kind of at the tip of my, okay,
so it's right, it's really
low,
right here.
Real low.
Right?
Yes,
So
exactly.
it's at her sacroiliac joint. And so if we take a look at the lumbar spine, the lowest of our vertebra, it sits right here. And one of the things is when Julie's working on a lot of our clients, she's in a forward flex position. Well, Julie has had 4 boys, and so she had 2 twins, and when she had her twins, what did you experience when you had the boys?
I had a C-section.
Yeah, so many times the scars can create electrical interference. And what that means is if we think of a nerve pathway that's going down into our core musculature and it's supporting and stabilizing our spine, any of these variables here can actually affect or create neurological disruption. So a scar essentially kinks our hose, so to speak. So if we think about this nerve pathway, if it's kinked, we have a decrease in electrical flow. So if we have a decrease in electrical flow, is the muscle going to get stronger or is the muscle going to get weaker? What do you think?
Weaker.
Weaker. So one of the things we have to do, obviously, is address the scar to make sure it's not creating any electrical interference. So a couple of ways we do it at the Body Project is what?
So we will use different oils to put on that scar or take internally if the scarring has affected us internally. That's one way.
So what are some of the oils we
So
use?
some of the oils we use are wheat germ oil, sesame seed oil, and then we also do a D3 spray with coconut oil in it that has D3K2 in it.
Yes, and that will help deactivate that scar. So it's like the hose is kinked, it will help unkink the hose. And another thing too that we use very effectively is you'll use obviously microcurrent.
Right.
So we can use microcurrent, we can use cold laser therapy, which we do a lot, depending on what comes up when we evaluate or test the scar. So for females, they can have a cesarean scar, hysterectomy scar, an episiotomy scar, any type of abdominal surgical scar that can create electrical disruption. Now, today what we're seeing more than ever is women are having unnecessary cesarean sections. And so not only does that create a lot of core dysfunction, but it can lead to pelvic floor dysfunction. So it leads to things like urinary incontinence, low back pain, hip pain. That can also affect knees. It can also affect the ankles just because of where the pelvis now is not functioning optimally. So in terms of digestion, we see tons of people on a regular basis with poor digestive health. And one of the things is if we think of Julie's core musculature, let's say she's having digestive distress. Let's say she's constipated, she has irritable bowel, anything of that nature that creates internal inflammation. Muscles are married to the same organs that they share nerve innervation with. So anything that creates inflammation within this neurological reflexive field can shut those core muscles down. And so here's the thing, if you're doing physical therapy, that's the structural component, but that's only one component. Many times there's maybe a food intolerance or they've got some sort of issue with the scars. If we have an inflamed ovary as a female, that can create issues. For men, an inflamed prostate can actually shut those deep core muscles down. So there's a lot going on with low back health today, and this is why so many people never truly get better. What's the one thing we hear all the time, people that have worked with multiple doctors, multiple therapists, is, you know, I did XYZ therapy and I got better. No, you didn't. You got out of pain, and there's many things that can get you out of pain, but if you're actually getting treated for the same condition, you're actually not getting to the root cause of the problem. And so one of the things is with Julie's situation is that scar was starting to come up. And when she was going into that forward flex position, working on people, because the deep core muscles were not functioning optimally, she was starting to get stress right here. And there's a ligament called the sacrotuberous ligament. And so what was happening is because she was not stabilizing with her core musculature, she was stressing out that ligament. And so even though she's right here every day, she didn't ask me what was going on. She was dealing with it. So lesson for today is when you've got issues,
come see Rob.
Or somebody close to you.
Yeah.
But
get some advice.
Yeah, one of the things is there's so many times people will sweep it under the rug by taking a non-steroidal anti-inflammatory, and what they're doing is they're focusing on one thing, and that's getting out of pain. And when you're in pain, nobody wants to be in pain, so a lot of times the first question they ask is, what can I do to get out of pain? Better question is, what's causing the pain? And then what we want to do is determine A, what's causing it, and then B, what's the formula to actually fix the dysfunction. So really quick, what we're going to do is I'm going to have Julie lie down. And what she's going to do is she's going to find her belly button. Then she's going to take her fingers and wrap it around here. If you find your belly button and you wrap it around, that's your third lumbar vertebra. So what she's going to do is she's going to put her fingers at her third lumbar, and then what she's going to do is she's going to put downward pressure on her third lumbar. Okay, so go ahead and do that. So essentially what we're doing is, if this was the pelvis, she's posteriorly rotating the pelvis back in a pelvic tilt. Now, what I see all the time is when women are trying to do this, guys too, is they'll go into hip extension, so they lift their butt or they overwork their thighs. Know anyone who's ever done that?
Never, never.
So, a lot of times they'll also either extend their legs too far. So as we get stronger in our core, we can lengthen this lever to challenge the core more. But as a beginner, to reestablish that, we have to make sure we start in maybe a position where the legs are closer to the butt. So what Julie's going to do is she's actually going to put pressure on her fingers. Go ahead. And relax. So she's going to do that for about 2 to 3 seconds. Contract. Excellent. Now, one of the things is if you're slightly deconditioned in this area, a lot of times what we're going to do is we're going to compensate. We're going to compensate by either lifting the butt or flexing the thighs. So we want to make sure there's no stress here in the front of the thighs or the glutes. Okay, so let's go ahead and do that again. Very good. And relax. Okay, so one of the things we also want to do is we want to engage or tense up, contract the pelvic floor. So how do we do that? By doing a Kegel. So what we want to think about is having to urinate and then stopping the flow. That's how we activate the pelvic floor. Now the reason why the pelvic floor is so important is because it helps stabilize that SI joint. Remember, the SI joint sits right here, okay? So if we take a look at another shot of the SI joint, here's all your lumbar vertebra, SI joint sits right below that. So if the pelvic floor is weakened, then that area becomes very unstable. So one of the things we want to do is we want to contract the pelvic floor to strengthen that, But another thing too is we want to take the nerve flow from the pelvic floor, draw it up into these deep core muscles to actually heighten or increase the intensity of those muscles. So it's really a 2-for-1 that we're getting here. Now another thing too, we've spent a lot of time talking about breathing, and remember, we want to originate the breath through the diaphragm. The diaphragm, even though it's our primary respiratory muscle, it's also a secondary spinal stabilizer. So we want to make sure when we're tilting, we're also breathing here through the diaphragm. Now for a lot of people, that's tough. It's kind of like doing this when you first start out, right? Is it not? Okay, so what I like to do is I like to separate it. We'll do a little bit of diaphragmatic breathing, maybe about 10, 15, 20 breaths. Stop that, and then just do your tilt, relax, tilt, relax to engage those muscles. And so another thing I see many times when people have worked with a couple of different therapists before they find their way in here is they're doing what I would consider level 4 and level 5 exercises. In fact, when I was going through an assessment yesterday, I had a gal tell me exactly what she was doing for exercises. And so she was doing this exercise. So if we take the hand here, let's just bend this, we'll come here. So she was doing this exercise. Now, it's not that this exercise is good or bad. It's just that that exercise was not appropriate for this particular lady's ability. She couldn't even do a proper pelvic tilt, so she wasn't even engaging those muscles. So we have to make sure that if we have a low back issue, if we have a hip issue, if we have a pelvic floor issue, we are not doing exercises that are very watered down, meaning you're just kind of going through the motions. You have to make sure you're getting proper advice on your technique and then also the sequencing. So in other words, we don't want you doing a level 4 if you can't do a level 1 exercise. And Julie, as much as she's exercised, one of the things is when you're talking about these deep spinal stabilizers, it's a lot of mental focus, is it not? Okay.
I typically have to keep my eyes closed to focus.
Yeah, and it's very important that you actually are very present with this type of exercise. So one of the things that we learned is even if you're very careful about your body positioning, if you're going into forward flexion, if your brain is not communicating with these deep core muscles when you go into forward flexion to stabilize because of dysfunction, think about this. This is half your body weight, that all the discs and these ligaments will now have to absorb that force. And that's one of the things that was going on with Julie. And so as soon as we turned those muscles on and really taught her to fire those, then the pain goes away. And it's amazing. So once we re-educate that musculature, then what happens is when she goes into forward flexion, it automatically stabilizes. It's literally like your body's in a weight belt or corset. So we have to make sure that we're conditioning those muscles, and you are conditioned in that area. Now, statistically, it's about 48% of all women over the age of 38 that have actually gone through childbirth have some level of urinary incontinence. So that also means they're very prone to low back and hip issues. Now, one of the things is a lot of times women will come in here, oh, I don't have any problems with incontinence. Really? You don't? You know, you're really weak in your deep core muscles. Well, unless I laugh or I cough or sneeze, well, yeah, that's urinary incontinence. So there's some level of pelvic floor dysfunction there. So we want to make sure that if you have any level of dysfunction, you meet with a qualified professional to ascertain what is the root cause of the problem. And one of the things I would caution you on is making sure you find someone who's evaluating your body in a holistic manner. Why? Because the body does not work in isolation. It does not work well in compartmentalization. It is an integrated unit, and we have to treat it as such. So that is our tip for the day. Hopefully you got some good information today. If you did, please go ahead and share the video. Like the video if you got some benefits from it. So until I see you tomorrow, go ahead and make it a great day. You certainly deserve it, and we'll see you tomorrow.